Welcome, everyone. I think it's 1 or 2 minutes after, and I think it's probably time to get going. Anybody that joins can join late. We've started the recording on this session, so if somebody wants to pick it up later, I'm sure we'll have it available. So this is something a little different than we're used to doing in Town Hall. This will be the Sewell's Point Virtual Town Hall teleconference. We wanted to give an opportunity for the public to ask questions and answers about the things that are going on in our community related to COVID-19 and the mitigation efforts that we're handling here in Sewell's Point and interfacing with our community partners in the other towns and municipalities right near us. I think, there we go. Just to give you a brief overview of how we hope to handle this is just a real brief 20 or 30 minutes overview from myself and Town Manager Berger, and then also finer points on safety from Chief Tina. But really the idea is to get as quickly as possible to a Q&A session if there are any questions out there. We'll handle it a little bit differently than we do our normal town hall meetings. So what we'll ask everyone to certainly be brief and stick to the 3-minute time limit. But what we hope will happen is that you'll just ask a question and then we'll try to answer it on the spot. And some things we won't know. But if you send us an email, or we'll go back and try to get the answers that you're looking for if we don't have them. But we're handling this fluid global medical health issue on a daily basis. So there are things that are happening in real time that's worth conveying to you on how we're handling policy on a day-to-day basis. And so we thought it might be beneficial for us just to have a conversation with you about how those things are happening and what's happening perhaps behind the scenes that you may not be aware of. I'll start really briefly with just resources and things that we've been doing. Hopefully, if you're tied into social media, as I am, or you're receiving emails, you should be getting quite a bit of information from the town manager on just information and activities happening around the town, but also important links that you can get additional information from. It's important in a situation like this that you find credible sources of information, and we'll list a few here that we provide as links that we follow, but also that we refer to on a regular basis for our ongoing stats. The Florida Department of Health is our watch location, especially for the dashboard, which we'll talk about in just a moment. And then we're tied in very closely to emergency management with Martin County. All of us take our direction from the federal level, from the CDC, and as you might know, and we'll probably editorialize here a little bit on the growth of this medical crisis is related to infection rates and positive test cases of COVID-19. So we want to give you a testing link. So if you demonstrate any symptoms at all, or you believe you need to be testing, and the more prolific testing we can do, even for people who are asymptomatic, will help us control the viral flow and community spread and get us back to business as usual as soon as possible, which is all of our goals, right? If you do need medical attention, certainly dial 911, but here's also a nurse triage hotline number if it's helpful. This information will be available to you on the line after this is over, so we can get these slides to you if you need them. Quickly, we'll drill down onto some numbers real quickly and show you where you can find these numbers on your own. Again, the information, the watchword here is find credible sources of information for yourself and check them frequently. The Florida Health Department has a dashboard that calculates and counts test results on an ongoing basis. So currently, as of today, around 1 or 2 o'clock, we were at a total of 6,338 cases. And 772 of those are hospitalized. Sadly, in the state of Florida, we've had 77 fatalities, which is not it's a horrible number, of course, but it's not anything like some of the other epicenter activities going on in larger cities. So we're very fortunate, especially here on the Treasure Coast and certainly in Sewell's Point, for having the distance and population density that we do that's helping us keep those numbers under control. And this dashboard also provides a graph of caseload. And I don't want you to be misled by the somewhat toppy-looking graph in the lower left corner of the dashboard, because if one were to look at that diagram, it would seem like we're starting to come down the other side. The unique characteristic of this particular disease is the long incubation period of this virus, and maybe I'm not telling you anything new. This is pretty common knowledge, and why you're hearing a lot of things about the 14-day quarantine period. Sometimes, and as you might be aware, we're a little bit behind the curve on testing. We don't have the massive amounts of testing we need, and the ability to test is being done on an as-needed basis for people who are actually showing symptoms. So the problem with that is that the numbers we're getting, while they're not great, they're probably 3 weeks old and behind the curve. So a lot of the reticence you hear within safety officials around town and on the media is that we need to err on the side of caution. So we're afraid, and we'll get behind the numbers, and some of those things are moving quickly, but be diligent now for the next week or two. If we drill down on state levels, if you click on the Martin County field of that map I just showed you on the Florida Health Dashboard, it'll give you specific information about our county. And we have currently 28 active cases we're monitoring, and 5 of those are hospitalized right now. So we're watching, obviously, if the results of your infection to COVID-19 requires hospitalization, the risk of further deterioration in pneumonia goes up significantly. So the Florida Department of Health monitors those numbers very closely, and likewise our safety and emergency management officials watch them closely as well. I'm sorry? Okay, I'm sorry. Let me see if this helps. Somebody's telling me there's a technical issue. Go ahead and look and see if it's still there. So, so just so you know how things happen here in Martin County, we get a daily briefing, and I'll let Michelle talk more deeply about her day-to-day activity with the emergency management system and her and Tina in a second. But we get on a daily basis this briefing dashboard that tells us where the cases are in our county and how testing and results of testing happens. So this is what we monitor regularly, and we see what the local state actions are happening around the data that comes out. What I'm hoping that you'll get across from this is that if you're looking out your window and you're going through your day-to-day activity, you're certainly realizing that we're in a new normal. Something is different now than it was, say, 2 weeks ago. And the issue is that we're making day-to-day decisions in a fluid manner based on the data we have at any given time. And as I mentioned before, sometimes the data is backdated. You know, that we know that there are many more cases floating around the community than are being tested for, but we're watching the test data because we have to be data triggered. And in addition to that, we have to work closely with our partners in other municipalities that are making initial and proactive leadership decisions based on the data they have as well. So today's Tuesday, and if you look at this chart, you'll notice a sort of a topping at and we believe right now that topping is based on weekend flatness, and we're hoping that number comes back down. But more likely, we know that the Martin Memorial and Cleveland Clinic testing facilities have tested more than 850 cases, and right now we are only getting responses back on 270 of those 800 to now probably 1,000 or more tests, and numbers for testing is going to start ramping up quickly in the next week or two. So personally, I sort of think that graph is a little bit misleading, but we're hoping that it doesn't shoot up on the backside. So there'll be some additional watch words on how to move forward based on that data, but you'll notice that as the spike has come up from, say, March 24th to March 28th, you've gotten additional directives from the state and from the federal level on services that we've slowly taken away over time. We didn't just immediately close the park, although the park is now closed. We didn't initially close the beaches, but you'll notice the beaches are now closed. So as the numbers continue to drive social distancing requirements and the community spread of this particular virus continues, you'll continue to notice services being further reduced. Our goal is to walk the fine line between what is appropriate to impact certainly our livelihood, our way of life, the emergency management capability of those around us, and also our ability to snap back after this issue is over is part of that decision-making process. So we have many schools of thought, and if you're following on social media, you'll see that there's people on both sides of the spectrum, and we're listening to both all the time, from the scenario of locking down immediately, not letting anyone move, to keeping some basic essential services open in that regard. And so again, this is a fluid scenario. I hope you'll work with us in this scenario, and we'll talk a little bit more during the Q&A session. But most recently, we have started following closely the inflow of outside visitors into the state. You've probably seen some news information on the lockdowns on I-95, on the ability to get to the Keys, on folks arriving by airports, to make sure that we have those registered and are tracking them to ensure that they adhere to the new governor's directive of 14-day quarantine for all visitors entering the state of Florida. And so that's, as I said, we are part of a process that continues to make these kinds of decisions on a day-to-day basis, and they're important that we adhere to them. I want to talk now a little bit more specifically about Sewall's Point. I can get the channel to change. There we go. So if you drill down on the cases in our area, you'll notice that Sewall's Point only has, well, not only, Sewall's Point has 2 active cases that are being announced as of today. As I said, we look at these numbers on a daily basis, and they could change any time. But you could get a sense of false security of how few numbers, and by the way, any community spread in our community is horrific, and it's what our local town, what Chief Tina and Town Manager Berger and I stress about, I'll say hourly. But you could think, compared to our communities around us, Stewart and Hobe Sound and Jensen Beach and Palm City, that we have a less impact. But if you took that data and took it as a percentage of our population, it's a very different story. So if you look at the cases in Martin County on the dashboard I just showed you, there are 27 of them, only 2 here, but we only have 2,193 people in our town. That is a percentage of population higher than all of the others. So it's important that we take this seriously, and that if you have older, if you're at an at-risk population for any of the things you see from your health providers, over 65 in age, or you're caring for your parents in your domicile, you're going to want to take extra precautions to make sure you're not bringing any pathogens into your facility where you're caring for those at-risk participants. So our goal is to communicate that, keep you safe, and we don't want to see the community spread increasing farther. At the same time, we also don't want to lock down services any more than are necessary. So I'll have to say that I go on a walk with my wife in the evenings on South River Road, and through that process, I see people adhering to the social distancing directives that are out in the media. I see people wearing masks, which I'm very pleased to see, and people keeping their distance. So we can talk a little bit more about what that means and what that means from a administrative perspective as well. So just real quickly, I'll end some of the few things that I want to convey before we let Town Manager Berger speak and Chief Tina, and then take some questions. But all the things that you're hearing on the news, we're reiterating to keep your diligence. Don't, we've been at this for a couple of weeks now. It's pretty disconcerting. It's an impact to all of our lives. We recognize that, but I will say that it's having an impact. Just from the graphs we're looking at recently, in the few previous slides, we can see that things appear to be slowing down a bit. I hope that's true data, but we won't know for a few more days, or maybe a few more weeks even. But keep social distancing, keep your hygiene regimens intact, wash your hands frequently. Again, we're in a, there's no official in our community lockdown activity happening. I will say that it's an ongoing conversation, and there is a special meeting coming up with the county on Friday. But to answer some of the questions that you might be having, we do follow the county directive, and we'll be listening intently to that meeting on Friday morning with the county commissioner and the emergency management systems. As you're aware, I hope that, and the reason for the beach closing is that we're trying, and the boat ramp closings, is that we're trying to limit social gatherings to less than 10 people, and the 10 people that are getting together, hopefully fewer than 10, are mindful of the distance of staying apart more than 6 feet. This has been a particular issue on the sandbar recently, and so the reason for the boat ramp closures is to try to limit the gatherings and groupings by boats and activity on the sandbar as well. So please be cognizant of the people you're around, the closeness with which you are interacting at Publix or at essential trips to grocery stores to get the needed supplies that you need for your home, but be diligent there. Where possible, and certainly where most of us in this town are affluent enough to either be business owners or working in a business capacity that drives some of our workforces. I've enabled all of my employees to work from home, and I hope that you are enforcing or advising a remote work capability for your employees as well. Obviously, those of us who have kids are seeing the impact of virtual learning and watching the school systems and all of our educational infrastructure move quickly to a remote learning scenario, and we're moving forward with that in various levels of success and learning in that regard too. And by the way, there's an educational process involved in that activity as well. More than ever, if you are showing symptoms, get tested. If you're showing symptoms, stay home. And on top of that, you should be treating yourself as if you are an asymptomatic carrier, and conduct yourself in a way that you may be carrying a pathogen to someone else that you do not want to be infected. So take extra diligence in that regard and help us flatten the curve. We're trying to avoid overloading the medical system. And there's plenty of media on that topic on all of the major news carriers, so I don't need to spend much time there, but the information is there and available. We've sent out a few links for what we mean by social distancing, and the Florida Department of Health has some great visual references on what to do, how to do it, and I just threw one on this slide here. I've gone through it on the previous slide, so I don't need to spend too much time other than just reiterating the fact that this particular virus travels through the air, and that's why we're asking you to avoid close contact and staying at least 6 feet apart from each other when you're out exercising or when you're in the local area. And even if you must go to work, make sure you're very diligent about the surfaces you touch and keeping your hands washed at all times. Lastly, this will be the last thing I say before we go to Q&A, and I turn this over to Michelle to say a few words. But I think I've given a few directives, but I now want to end on more of a positive note. You know, we're all in this together. We know that this is a difficult period in all of our lives. We live in a beautiful area, and we're fortunate to have the distances and the population density we have here. Others around us are not so fortunate. And we want everyone, and by the way, there are various levels of relationships within the town. We need to be cognizant with one another on the social distance we keep, even in our small town, as I showed in the graph before. Our participation per population is higher than the rest of the Treasure Coast. We need to keep that under control. But by all means, stay neighborly. Things could very well get worse before they get better. So we need to stay informed on what's happening, and then we need to look on the other side of the curve. We are fortunate in that most of us, many of us in this town, have some level of economic control over our economy. Each one of the commissioners on here are entrepreneurs unto themselves. We're all business owners, and we recognize the impact to our employees and to the economy when the economy comes to a standstill. So very diligently, we need to be looking on the back side of this curve and understanding that we will get through it. We'll snap back effectively. The slowing down and stopping of the economy is an artificial statement, but it's having real world implications. So we need as quickly as possible to get back to business as usual, but not before safety is in the highest of order. We care about human lives before we care about profits, and now's the time for us to come together as a community and follow the directives that are given by our safety officials to keep our overall community safe. And really, that's what this activity is about, as uncomfortable it is for all of us. That said, I think, Michelle, I'd like to turn it over to you for a few minutes to bring us up to date on mitigation strategies around the town.
Thank you. Mr. Mayor, I want to just start by saying thank you personally to you for facilitating this conversation. And that's really what the intent of this is to offer some information, but really be part of the conversation with the town. And being so close to the town, I thought it was a great idea that you came up with this, and really just want to start by saying thank you for this opportunity. So our town mitigation strategies are what you guys have been reading about when we send you emails and when you take a look at what we have posted on the internet on our website. But let's go through it real quick. So as you know, we've canceled events and we've canceled some gatherings that we had scheduled. And unfortunately, you're going to get an official cancellation now of the upcoming Easter events, the egg hunt as well, because we consider that to be an event that's just not worth having because of the social distancing issues we won't be able to, be conforming to. So we're going to continue to watch that and be diligent. We've also employed technology, not just for our meetings, but for this. We've really examined and tried different option for what we were going to need to do. And now you changed my slide on me, didn't you? Did you? There you go. So the technology itself for this is pretty special too. So and this enables us to be able to have not just a one-way communication, because when we're sending you emails and putting some posts on Facebook, quite often that's just a one-way communication. This today is going to enable you to talk back to us and have that true conversation. And with that, we are excited about it. So no general public access to town facilities. What that means is we continue to keep our facilities, town hall and the park, closed to the general public. We typically have somebody inside of town hall all the time, and we're using a remote system, a intercom system, if you will, at the front door. So while we're asking you to utilize our website, send us emails, and just pick up the phone and give us a call when you can, we do have somebody here, and we are using the technology of the intercom at the front door when necessary. So from a decontamination standpoint, we've increased our cleaning in the facilities. We actually had somebody come in from outside agency and even spray down pretty heavily the chambers after our last meeting, and then again after our voting when we had the presidential primary, so to make sure that it's as clean as possible. And we've also had some opportunities for our public works guy to go over to the parks and spray some disinfectants and clean down the playgrounds and the benches. That being said, we still are not confident that it's clean enough to allow the kids to play on it, which is one of the other reasons that we've decided to close that park. So please be patient. We're doing that for all the right reasons as well. I'd like to ask Chief Tina to kind of give us some idea now also on what's going on with the officers in our agency.
Thank you, Town Manager Berger. This is a circumstance that the police department has planned for over the years as a result of previous pandemics such as the avian flu, swine flu, and H1N1. And as a result of that, the police department's had a cache of personal protective equipment such as gowns, N95 masks, gloves, and eye protection. Once we realized that the scope of this pandemic would be more impactful than previous pandemics, we quickly secured enough PPE to sustain the department for an extended situation, as well as resources to continually decontaminate the town hall, police department, and our shared vehicles. And currently, I feel confident that based upon what we know today, that we have adequate personal protective equipment to address the COVID-19 situation, especially on medical assists. And while we can't eliminate the risk to our officers, this is a pretty fair way of doing so in terms of mitigating it. In addition to that, we are modifying some of our job tasks. In particular, there are things such as you may not realize that we check all of the commercial properties every night, like an old-fashioned police officer rattling the doors. And we've instructed our officers to wear disposable gloves when they do that to make sure that there's no transfers, because in particular, metal seem to do a better job of sustaining the viability of the virus. We are taking calls over the phone if we possibly can. And if need be, our officers will use their PPEs as needed to ensure their safety on any task in which they feel that it's necessary. Thus far, the only service we've discontinued is the installation of the TSP decals on vehicles because that requires several points of citizen contact. We're still staffing the police department as normal during our operational hours to assist you any way that we can. And of course, as usual, we're available 24 hours a day, 7 days a week by dialing 911 or calling the non-emergency number here at the police department and using extension 25 to transfer your call to the Sheriff's Office dispatch. And they are our dispatchers. We've had some concerns expressed to us about out-of-state visitors, especially from the tri-states and some other areas of concern. Each of our officers has on hand the Department of Health's mandatory self-isolation forms, which accompany copies of the governor's executive orders explaining the requirements for self-isolation, as well as a signature form for our visitors informing them of the need to quarantine. And this would be something that if need be, if it had to be followed up on, we would go ahead and refer that over to the Department of Health. The most common question that we've had thus far is from individuals calling wanting to know who it is in the town of Sewell's Point that is COVID positive. This is confidential information. If one of our officers were to respond to an address with a COVID positive patient, the officer would be notified at that time to employ the use of an appropriate PPE and modify their tasks as necessary. But I should remind all of you that knowledge of who is or is not positive in the town, or anywhere else for that matter, should not change our behavior. We should all be acting as if we are personally infected and that everyone we encounter and everything we touch is infectious. If we do that and keep our distance of at least 6 feet apart, engage in frequent and thorough hand washing, and disinfect high-touch surfaces often, and avoid touching our faces, we can tremendously reduce our risk of infection. Additionally, the police department is also asking that everyone try to be flexible and agreeable. As we proceed through this period of social distancing and needing to shelter in place, it can become anxiety-provoking for some people. We want us to all be flexible in our perceptions and as non-judgmental as possible. We all deal with anxiety differently, and what you may think is appropriate and necessary might not be shared by others. And let's try not to judge others by their reactions, but try to support and comfort each other as we go through this unprecedented time together. COVID-19 has made everyone cautious, and some of us are afraid. Be open and comforting to others, and most importantly, take care of yourself. Do more of what you enjoy and makes you happy. Maybe dust off some old hobbies and pick up some new interests. And always try to remember that a smile can be offered from any distance. And sometimes that's all someone needs to go ahead and make a change in their day. So if there's, I just hope that that kind of gives you an idea that we're still here to protect you, just like we always are. And we feel comfortable in the environment that we're working in currently. Thank you, Town Manager Berger. Mayor
You're welcome. One of the things that we were talking about earlier today, I was talking about it with Sherry and with Chief Tina, is that it really feels like when I wake up in the morning, I feel so appreciative on being healthy. I wake up, I think, okay, I'm able to breathe. I feel good. And it's just an eye opener as to, how we sometimes just take for granted when we're just well. The other thing I was talking about last night is all of these people all over the world right now are home with their families. And so often we've been like wishing, I wish I could get a week off or 2 weeks off. I would sit with my family, I would read to the kids. And so here we have an opportunity, albeit it's under strange circumstances and scary circumstances. But I got to tell you, I really hope that when this is over and everybody that's well has an opportunity to look back, that we don't look back and say, gosh, I wish I would have enjoyed that time a little bit more. So this is that time. Let's try and figure that out. So what now? So as a residents, as people, the humanity of it all, it's so stressful. And so think truly about not only your physical fitness, but your mental fitness. What can you be doing, and what maybe you want to do differently that you always wanted to do to be able to boost your immune system? That's really a good goal. Eating and drinking right, absolutely help that. Rest is so important. All of those things reduce your stress. And as Mayor Fender said before, neighbors helping neighbors is going to be so important. We want to make sure that we use empathy. And for me at my house today, that was our word of the day, because we are doing some homeschooling, like so many of you. And we had that written on the board today for empathy. But try and remember that everybody's going through something. And certainly at this time, we're all going through a whole heck of a lot. And I want to be very sensitive here, because the problems that we have from a town standpoint and from individual standpoint are real. But Mayor Fender and I were talking before about some decisions people are making that are so extremely real that we have been blessed not to have to make. And that's, do I have to induce my pregnancy, my childbirth earlier because I don't want to go into the hospital, or I can't go into the hospital in 2 weeks? Do I have a family member that's dying and possibly dying alone, and I hope somebody knows how to use FaceTime just so I can have an exchange with them? Both Chief Tina and I both know people that are dealing with COVID and are hospitalized, and so there are extreme measures out there. And we all know people that don't really believe that this is even an issue. So as Mayor Fender says, what a balancing act we have before us. So please help us to help you, and think about these things that you can do as residents. But the most important thing you can do is stay home. If you can, stay home. And we hear the governor has put that stay home in place for down south, and understand that if you believe in his theory, the governor's theory of when you squeeze a balloon, that balloon is going to move out to a different part, then you have to believe that as the southern end of Florida is getting squeezed, we are going to start to feel the effects of that pretty quickly. So if you do not have any urgent need to leave your home, stay home and enjoy your family and the people that you're with. Check on your neighbors and make sure they're good. Okay, so COVID-19 mitigation strategies. What we're talking about as to what's next, following Martin County's EOC per our charter. What does that mean? So we are, by charter and by Florida State Statute 252.38, underneath their guidance. And so we must follow the director of the Emergency Operations Center, and that's what the EOC is. And so Friday morning will be interesting for us, because the Board of County Commissioners in Martin County are having a meeting on Friday morning, and we are looking to understand what they are going to be announcing and maybe some potential steps. And so just as a side, just to make sure that we're prepared, we also will be scheduling a meeting for Friday afternoon for our commission. So we're also looking at supporting our CDC recommendations for mitigation. Well, we're not going to move off of that topic at all. That will include you guys checking with CDC regularly to remind yourself too. Prioritize town projects. So we had some emails that were sent in to us, concerns. Are you guys moving forward on projects? And so I want to talk to you about that. We have not received any direction from commission to stop projects. And that's okay. And let me explain to you why. So North Sewell's Point, the septic to sewer, we are still working with our partner, Martin County Utilities and Jamie Underground, and India Lucy out there is over 50% complete already. And there's no more money at this time that's going to be dedicated to that project. The bulk of the monies and expenditures that will be happening for the next couple of months will come from Martin County Utilities in that group. And we already gave that, we already were able to receive the money and then give over some of the funds that we received from the appropriations grant. So North Sewell's Point project moves forward. High Point water main replacement, also a Martin County Utilities project, no money from us, is moving forward. They, at this point, will start construction scheduled for the day after Easter. I believe that's April 13th. And completion time is in mid-September on High Point. Again, no money from us. And South Sewell's Point Road, still moving forward because we don't have anything going on yet because we haven't opened the bid. So we have out to bid the project for the phase 1 of South Sewell's Point, the raising of the road, and we'll have that bid officially opened April 9th. And at that point in time, then staff will have to work with the engineer, town engineer, and understand what the numbers are, what the pricing is that's coming back, and then start recommendations, preparing recommendations for the commission. And so, you know, from a financial standpoint, we are set and good on all of these projects and continue to move forward. Finances are a priority, not only for the commission, but we know that the public has told us that's a priority for them as well. So we are anticipating revenue reductions, but not a lot. So we have some revenues that come into the town that are obviously going to be impacted. And that's going to be things like our alcohol sales tax revenue. But what I want to let you know is that in our budget, we only anticipate getting $2,000 a year for that. And so while we're projecting a 30 to 50% reduction there for the balance of the year, that's not going to be a large amount of money. But from revenue streams right now, I want you to know that we are on budget for intergovernmental revenue collection. We are ahead of budget for the ad valorem tax collection. We're at 93% collected for this time of year. And given that we're only 50% through the fiscal year, that means we're ahead of the game for collection. We're ahead of schedule overall for collecting revenue from local sources as compared to the annual budget. And we're under budget for the local taxes that are under 50% year date on areas like civil fines, the electric franchise fee, people are using less electric, and local business taxes and interest. But from a revenue standpoint, we are still ahead of the game. From expenses, we are on budget and feeling very comfortable. But we recognize that there may be unanticipated expenses as this virus and health crisis continues. And so we're being very conservative. Potential fee reimbursements are out there for us. And so we have new tracking systems for any hours that are spent on this issue or any supplies that are purchased, etc. They are all being budgeted and accounted for separately so that we can put in for FEMA reimbursements. And lastly, I want to remind everybody that the commission voted for financial policy practices that put reserves in place. And the reserves are steady and they are in place. So we have 3 months worth of operating reserves solidly there and just under $1 million in disaster relief available as well as other reserves. So we are very comfortable right now and not concerned, and we'll continue to monitor that.
Thanks, Michelle. Appreciate that. That's a great overview. And also, I'd just like to also convey my thanks, and certainly I'll speak for the town, the thanks from all of us for the diligent effort that you and Chief Tina put in on a daily, hourly basis. So we're very fortunate to have your leadership and Chief's leadership, and the town is benefiting daily by that. And also your, just the interaction you're having from a professional basis with the other administrators in the other municipalities like the county and city of Stewart. So thank you for all you're doing, and that was a great overview.
Thank you.
And your sense of community is also heard. That's super important that we continue to be neighborly. That said, that was about 10 minutes longer than we anticipated on the overview, but this is really about a public Q&A as needed. And so we'll continue this as long as appropriate or as long as people want to chat. If you have to go, I'm happy to stay. This is a simple video conference. But again, I would ask people to be cognizant of the 3-minute time frame. And, but we want concerns from the town to be brought forward. And we want, if you have questions that you feel are not being answered or that the services are not being there, or you just have questions about how you should progress during this unique time in our history, feel free to bring them forward. You can answer your questions via chat, or you can just raise your hand. If you're dialed in, I think it's a *9 to raise your hand, or if you're on the Zoom computer, I think there's an icon that allows you to raise your hand as well. So I'll see if I have a couple of questions that came in via email, but I'll ask Sherry to also let me know if she sees a question come in. So first one, and then Chief Tina or Michelle, if you feel more appropriate answering, you can unmute yourselves and we can all answer these. First question is resident Karen, who lives on Palmetto Drive. I'd like to know how many COVID-19 cases we have on Sewall's Point, if they are travel or non-travel related, and if they are quarantining on Sewall's Point or in another location. Thanks. So I'm going to leave it to Chief, I think, because only she knows locations. And again, I'll reiterate that we're not legally allowed to convey much information based on HIPAA requirements. But Chief, do you want to address that?
Sure. We have 2 confirmed cases within the town of Sewall's Point. I can positively tell you one of them for sure is travel related. I'm uncertain on the second one. And I do know one is quarantining here in the town. I don't know about the second one. But again, I do want to emphasize following proper practices will keep you safe. There's folks out there who can be carriers who are asymptomatic, who may think they have the common cold, who are still out there. So again, we have to maintain that social distancing, a lot of hand washing, a lot of antibacterials on our hands, hard surfaces, and that's what's going to keep you safe. Knowledge of who lives where and whether they're present in the town is not of benefit from that standpoint. Just go ahead and adopt those proper practices.
Thanks, Chief. Appreciate that. The second question is actually very similar, and I'll probably have the same answer. Please update us tonight on the number of COVID-19 cases that there are currently in Sewall's Point, and indicate how they contracted the virus. Examples might be overseas travel or contact with somebody that went on overseas travel recently from the U.S. to the area with a higher number of cases, or contact with someone that has been to one of these areas. Of great interest would be unknown, which are people that possibly contracted the virus locally. I'm very concerned about the number of people in Stewart that do not socially distance when in the grocery store. So I think the answer is the same as the first part, but the last sentence is certainly appropriate. Since most of us, and I'm not sure if we mentioned it earlier, that my personal perspective is that 95% of the population is adhering to the CDC directives. So I've been very impressed with our town's personal social distancing practices in place. I haven't seen the need for a police action because most of us are taking this fairly seriously. But we do have essential travel, and we do have to restock our pantries. And so one of the places that we are most at risk is at Publix on the island, right? And the aisles are narrow, and I would say, to be safe, wearing gloves is not out of the question, and I see many people wearing masks. And make sure you get in and get out. Don't touch a lot of things, and wash your hands. I know my wife is diligent about washing her hands at Publix on the way out after we've picked up the food we need. And I've had other friends who are actually using Lysol wipes to wipe down the cans and packaging of those materials once they come out of a public supermarket. So maybe something to keep in mind. Those are the only two email questions I had. I did see some chats earlier regarding wishing that Michelle and Chief Tina had video, and I concur with that. I use video a lot, so I'm pretty used to it. But sometimes video is a personal decision, right?
Well, I can answer that. I will tell you that over the years of saving money and being frugal here at the town hall, we just don't have PCs that have cameras on them. So we apologize for that, and they're at the end of their life cycle, I'm sure. So we'll see that in the future. We'll try and add that in. But I also see on the chat from Mike that he was asking a question that says, if it's okay with you, Mayor, I'll go ahead and answer.
Yeah, absolutely. Please go ahead and do it.
Says, I'm having trouble finding the statistic, but I think Mayor Fender touched on it. Is it accurate that a large quantity of tests from within Martin County are still outstanding? And what I have here is exactly the words that the president from Cleveland Clinic, Rob Lord, used yesterday at the Martin County meeting. And so I'm going to go ahead and read what he had here. He said that they took 6,000 plus by phone, and they tested over 500 at the drive-through location alone. 634 were tested, 236 results came in, and 398 are pending. And that was as of yesterday from the public meeting when he stood before the Board of County Commissioners and offered that information. Now, the complicated part that he shared was that's from Cleveland Clinic, and because there's so many individual doctors and outside agencies that are also testing, but we don't know about them, we only find out when they become a confirmed case or a case that goes through the health department. So everything gets funneled through the health department. And so the health department is really who would know the final numbers that are coming out. But at this point, we just don't know who's testing everyone. But that's the information that we got from the president of Cleveland Clinic as of yesterday.
Thanks, Michelle. Probably that's a great way to do it. If you have a question, if you type it in the chat interface, if you have that availability, that makes it easier for us to understand the question and answer it. If you would like to speak, feel free to use the raise hand. And I think, what did we say? It was *6 for hand raising on the dial.
If you have a phone, *6 will let the mayor know that you want to speak. Sounds like somebody's got it up.
All
right.
Oh, there we go.
Am I on?
You are. You can speak if you'd like to. Who's this, please?
Don Weiner.
Oh, hey, Don.
As the mayor knows, I've had conversations with our state senator, and I've also been watching television, the news, and I listen to what's going on, and I find that so many communities are reacting after the fact instead of prior to the fact. And as one of the Washington medical leaders has said, if you wait till your cases spike, it's too late. And I've watched and seen 26 or 27 states now have mandatory stay-at-home orders. I know that the cases are increasing as they move north, that official statistics are not always correct. It's my understanding that there are 2 reported cases in Sewell's Point and 3 unreported cases in Sewell's Point. And I don't know how that exists countywide. The state has given the county and the town, municipalities, the opportunity to do whatever we want. And we can order a county can order stay in place, the county can order fines, the county can do whatever it wants. I'm concerned that despite the wonderful efforts of our town, our chief and our town manager and our mayor, who I know has put in a lot of time and a lot of phone calls, at least from me anyway, the effort, I think, needs to go further. We are, as you know, a small town, and we are sort of a puppet at the hands of others. And I'm hoping that we can lend our voice. My wife and I have been self-quarantined for quite a while. We use the delivery service for the supermarket. Costs a little more, but cuts down on the risk. We have one great, the one thing that's wonderful about or amazing about our quarantine is we haven't killed each other. So that's a very positive thing. In any case, I hope that we can try and convince our county leaders to be more restrictive. Certainly we know, or some of us know, that people get in their boats and they go to the islands in the middle of the river and they get together and socialize and have parties and don't obey the social distancing restrictions, and then they come home and they're in the community. And I don't know if Florida Marine Patrol can be helpful there, or we have some other way of working at it, but the county has all the legal ability it wants to eliminate that. I just know that whatever it is we're doing, it's wonderful. Like the mayor, I walk every day. It's in the morning with our dog. I should say the dog walks us, but anyway, there are a lot of people out there, a lot more people since they're all staying at home, and everybody's good about social distancing. So it's nice to see the community out and about, but I just hope.
We're at 3 minutes, Don.
All right, I'm sorry.
No, it's fine.
My final word is, I think we need to get ahead of the game instead of reacting to it. And I'll shut up.
Mayor?
No, that's great. Appreciate the input. Yes, by all means, Michelle.
So, former Commissioner Weiner, yes, I will tell you that our commissioners have also been struggling with this conversation of civil liberties. How do we make sure we're enforcing what appropriately should be enforced? And there's even been some discussion about making sure that the solution isn't worse than the disease itself. And so we've gone back and forth quite a bit, and so have the county commissioners. And if you watched the county commission meeting yesterday, they had a chance to voice and debate their issues in public. And where we're at is this. I don't know what history will tell you, but I want to take an opportunity to tell you that you would be very proud of your chief of police right now. She has quite a history in education in communicative diseases, and has used that voice of hers as we are in our EOC meetings and in our unified command meetings to help everyone make transitioning statements. Okay, so we are moving in a direction that's probably going to be more like what you want, Don, I think, as a region, but we wanted to do it in a collaborative way. And so, the view that Sheriff Snyder shared with everybody is, while we're being very cognizant of these problems that people still come together, we also have a lot more wide open spaces than we do down in, say, Miami. So we want to be able to have the appropriate restrictions while also allowing people to go out and walk where we can, because fresh air is good and sunshine is good, especially with this type of thing. And the mental fitness is so important. And so being able to create that balance is what we're spending this week just debating and fighting over. And we're fighting for our residents to make sure we get the right answer. And I would say stay tuned. Stay tuned, because the meeting on Friday is going to be a little bit more in a way of memorializing something that will help get us in a direction that we can, create some teeth. But the county that we're working with, they truly want to do the right thing for the constituents, but they're a constitutional county. And that means that they must do what the governor tells them to do. They're not a charter county. And our charter is written to mandate that we follow Florida State Statute 252.38, which puts us in that same position. The only people that we can listen to on something like this is the director of the EOC, and that is at the county level. And so what we want to do is be supportive of our county officials as they're making these tough decisions, and your voice to them, I'm sure, is very helpful as they're trying to make these decisions. So it's just, we've definitely been struggling, as Mayor Fender said earlier. And I'm pretty happy with the way that our town has been responding. And if we could get more people to understand that staying home is the right choice when you can make a choice, we'd all be much better off.
Did we mention, Michelle, that we're expecting a little tighter lockdown from Port St. Lucie later this week?
You know, I had an opportunity to watch the mayor of Port St. Lucie's, what I call a campaign with the public on his belief that they should lock down. And he doesn't like to use the word lockdown, but it's a stay safer at home methodology. And his point of view is one that I think is resonating with the county officials in St. Lucie County. And that looks more like, we want you to stay home. We're asking you to stay home. Don't make us enforce you to stay home, but we're telling you, you got to stay home. And there's this 15-page document that the St. Lucie County officials have started to craft. And so they're moving in that direction. And that is, you know, what we know. And so I believe that everybody's trying to do the right thing without invading too largely into the, you know, the liberties of our individual citizens.
Well, we'll be listening intently on Friday to what the emergency management and the county commissioners do going forward. And obviously, a lot of the things that will happen will be numbers driven, right? Like I said, our numbers are lagging, but ultimately there has to be a data trigger to many things that we do.
Yes, the Cynthia, yes.
So, great points, Don. Appreciate it. See some great accolades for the chief in the chat box. Do we have any other questions or input from anyone? Don't see a hand raised on the participant list. So we will hang out here for just a few minutes until we realize that we've answered all the questions that are there to be asked, I guess.
I see Deb, but Deb, did you want to say something? Oh, okay. Just making sure.
All right.
One quick word. I just want to thank Frank, you, Tina, and Michelle. I know how hard you all are working. I don't know that the town appreciates it or understands it, but I think you're all working 24/7. And I personally want to thank each of you for doing that. Thank you.
Thanks, Don. Appreciate it.
Thank you.
Thanks,
We
Don.
love our community
Appreciate
and
it.
its community servants. All right. Well, thanks for your time, everyone. Like I said, I'll hang out here for 5 more minutes, but feel free to disconnect as you see fit. I don't see more questions coming in. Feel free to email us anytime. Michelle, what's the best email to send if you have questions?
You can send it right to me if you like. mberger, and remember it's B-E-R-G-E-R, so M or B-E-R-G-E-R at sewellspoint.org. And if I may just let everybody know that the entire commission, while operating under sunshine, has been on the call just to be supportive and listen. But because of our rules and laws within the state, they are unable to participate at this time. But just know that your entire commission is supportive of this call. And you guys all everybody did a great job. Mayor, if you don't mind, one of the things you had shared with me is your gratitude for our team as well, and the people that are working, our non-essentials are working from home, and the people that are working here, and especially our officers who are putting themselves at risk. You just want to touch on that, please? Oh,
yeah. And I think I conveyed to Chief earlier in the week my thanks for all of the first responders and her staff and her team that's coming together. But also, I'd like to thank Sherry White for the effort in putting this teleconference together. I know she worked many hours trying to get Zoom organized for us to have this call, and it seems to be going fairly smoothly, at least on my side. I understand there's some video issues, but great job, Sherry. I appreciate the effort. And, you know, it's I can say it's pretty troublesome running day-to-day efforts in town hall. And Lori at the front desk with the movie theater ropes in front of her effort, and our new building official. So, you know, things are moving forward, but I have to commend all of you for the awesome effort of working around this pretty trying time and what I would say is an unprecedented point in our history. I've never seen anything like it, at least in the 18 or 19 years I've been at Sewell's Point. So thank you. And, you know, it's also a testament to awesome professionalism. It's great to work with a team of professionals that have the experience that Chief Tina has and has the deep community ties that you have, Michelle. So thanks to you and all of your staffs and Sherry. Oh, we have someone jumping in. So I think we have someone with the last three digits of 846 who's asking to speak.
Okay, that's me. Can you hear me?
Yes, ma'am.
Okay, Kathy Muskowski.
Okay.
And I just want to thank you all for the teleconference and just to be able to say, too, that each and every one of you was very easy to understand, so the audio was great. Okay, I'm only on a smartphone, so that's the way I logged in. So I'm not on the tablet or did the Zoom.
We're trying to
but anyway, I just want to compliment you on that and just let you know that for me, I had no trouble at all.
Awesome.
And thank you, each and every one of you, for everything you're doing.
Thank you. All right, how about one more sobering statistic, and then you can say something positive again, Mayor.
All right, go ahead.
I really just, it's important that we don't downplay this because it's beautiful outside. It's easy to forget if you don't know someone personally. But yesterday was again the record breaker in the United States. As a nation, we had over 500 deaths. And every day is a new day. Yeah, in one day. And the projection from the White House, because as you know, I've said it before, I'm not sure if y'all have heard this, but we have calls with the White House every Wednesday. Now, we don't get to speak, but we get to listen. And there is a projection that there may be as many as almost 200,000 people that pass as a result of COVID-19 before we're done with summer. Those are real numbers, and those are real people. And so please make sure you take care of yourself first. Like they say, when you're on a plane, you put your mask on first, and then make sure that your family and your neighbors are set. And this community has been so special for me to get to know, and being able to do these kind of things where we know each other and talk to each other. It's time to come together and take care of each other as well. And it will get worse before it gets better, but there will be better days, and we will be enjoying our time together and have plenty of opportunities to come together face to face soon. And now I'll stop talking. Thank you, Mayor.
No, thank you, Michelle. And yeah, that's, we're watching the numbers closely, and we hope they don't spike, but all indications so far is that they will. So let's keep positive, look on the bright side, try to get on the other side of the curve, and let's all stay Martin strong.